This is my homie Hillary. Hillary's glory days of wilding out has finally caught up to her. She has been experiencing lower back pain for months now and has been begging to learn more about its cause and what can be done to stop the suffering. But Hillary isn't a lone wolf in the struggle. More than 80% of people will at some point experience an episode of lower back pain. Bum, bum, bum. I know, scary. So what in the hell is lower back pain? Lower back pain is broadly defined as pain below the costal margin and above the inferior gluteal folds. Pain could be due to an issue with the vertebrae or intervertebral disc of the lumbar spine, muscles of the lower back such as the thoracolumbar fascia, or ligaments and tendons running along the back. Pain may be classified as acute or chronic, acute being less than 3 months and chronic being more than 3 months. Hillary, I know you're probably thinking, why me? I'm still so young. But surprise, ain't nobody safe from back pain because it can develop in anyone, even children and teenagers. There are many factors that increase a person's chance of developing lower back pain. So what are these risk factors? There are 2 types of risk factors. The first is uncontrollable, which by the name you probably already guessed it. These are the factors that are unchangeable no matter how hard you try. These include a person's age, gender, genetics, etc. Here's an interesting fact though. Studies continue to find evidence that prevalence rates of lower back pain do increase as we add more candles to our birthday cake. So as we age, we become more vulnerable to the types of injury and disease which cause lower back pain. The second type of risk factors are called controllable, and these you can definitely change, such as your lifestyle habits. This often includes the physical strain you put your back through on the daily, how often you exercise regularly, or how much you like sitting your butt down on the couch all day long. These can all increase or decrease your chances of experiencing lower back pain. Hillary, are you still with me? Okay, good. I hope you didn't forget about diseases having a hand to play in this game. Diseases including osteoporosis, arthritis, and sciatica are all well-known causes of lower back pain. Arthritis causes inflammation of the joints between your spine, which produces pain. Sciatica happens when the sciatic nerve, which travels from your lower back to the back of each leg, becomes injured. This nerve damage causes pain in the lower back. Osteoporosis causes your bones to become so weak they fracture from the most mundane movements like coughing or bending over. This happens when the rate of bone formation and breakdown are out of whack, kind of like when you're trying to take a bath. You need to have some water, but not so little that you can't even soak in it, or so much that it starts overflowing like Niagara Falls. Ready for a plot twist though? Not all cases of lower back pain originate from such obvious causes. The majority of adults experience lower back pain that is non-specific. This means that there is no direct cause of the injury. Back pain is complex and there is not usually one direct element contributing to the pain. This makes it difficult to understand the exact cause of lower back pain and is why so many cases are diagnosed as non-specific. Okay, Hillary, I know you're curious as to how in the hell one can go about diagnosing back pain and what treatment and prevention plans could you do to help, and even what the future research looks like for lower back pain. Well, Hillary, my homie, you're in for a treat, and unfortunately, it doesn't involve sprinkles. We brought in the experts to help answer those questions. First up, we have the stunning Kyle Poland, who has his bachelor's in kinesiology, is a current Master's of Science candidate in Biomechanics and Neurophysiology with a focus in studying pain. I'll let him take the wheel now.
So when someone comes in and we want to talk about their pain, what we're really trying to figure out is what's causing the pain. So an analogy for that I would use is if I was out for a walk somewhere and I stepped on a nail and a nail went into my foot. Would the treatment plan be based around getting rid of my foot pain? Or would the treatment plan be based around getting the nail on my foot? It's the exact same with low back pain. If you've herniated a disc, the treatment plan is not give me a whole bunch of painkillers and try to get rid of my pain. It's to fix the herniated disc. That's the thing that's actually causing the problem in the first place. So low back pain is more of a warning signal than it is a diagnosable disorder. So that's one of the reasons that treating low back pain is so complex. There's no cookie cutter, you come in with low back pain, these are the exercises you do, this is how we're going to treat it, this is how long it's going to take to go away. Because there's no way of knowing that, because low back pain can be one of a million different things. So if there's one takeaway from discussing low back pain, treating low back pain, the key is it depends. All right, so when it comes to exercises for low back pain, like I said before, low back pain is a huge range of different disorders, but generally a lot of exercises will help treat all of them. So I'm going to demonstrate two of them. One's called a dead bug, the other one's a bird dog. They're essentially mirror images of each other. But the goal when it comes to core training is a lot of people like to think low back injuries come from a lack of flexibility or mobility, when often it's actually a lack of stability. So when it comes to core training, you want to try to think about doing exercises that are actually going to stop you from moving, rather than things like a crunch or a sit-up or a back extension that's going to make you move. So I'll show you an example of what that looks like. So the first one is a bird dog. So you get down on all fours with your hands under your shoulders, your knees under your hips. Then what you're going to do is raise one arm and the leg on the opposite side, straight out, so that they're parallel with the ground, and come back down and repeat on the opposite side. So the key here is I'm not kicking up or reaching up too high. I'm going just parallel. And so the reason for that is we want to be doing what's called an anti-rotation exercise. So as my arm and my leg lift up, it makes my body want to rotate because gravity is pulling down on the arm and leg. So my core has to brace, not just my abs, but all the way around to keep me stable so that I don't end up twisting. So the goal is to the opposite of most exercises where you're trying to twist and now you're trying to not twist. The opposite of that is the dead bug, where you flip upside down and do essentially the same position. So your knees are right over your hips, hands right over your shoulders, opposite arm, opposite leg, and coming back up. Exact same idea. You're doing a coordinated core motion using your entire core, trying to train that good muscle activation pattern that's going to keep your core stable when you're doing activities of daily living, like picking something up, walking up the stairs, anything like that. Again, trying to not move rather than trying to use your core to move. So that's generally the trend when it comes to rehabilitative exercises for the lower back and for lower back pain. A lot of doctors and so on, when you go to them, will say, oh, your back hurts because you have a weak core or your spine's not flexible enough, so you need to do more setups and more stretches. When that's not actually the case. The case is stop doing sit-ups, stop doing stretches, focus on stability instead. So that's where exercises like the bird dog, dead bug, planks, side planks, anything like that, where the goal is to stay as stable as possible, is a better alternative if you're dealing with lower back pain.
Isn't Kyle a beautiful man for dropping all that helpful knowledge on us? I think so. Next up, we have another gorgeous expert, Jared Norrie, who completed both his bachelor's and master's in kinesiology and is currently a PhD candidate at Brock University studying in the low back field. This is what he had to say about the future of low back pain research, and I quote, "What we are starting to look at is the patterns that emerge for spine motion and categorizing the favorable and less favorable spine coordination patterns." Don't worry, I'll act as Google Translate. Basically, he's saying that we know that lifting super heavy stuff could lead to low back pain, but since we see those strong men and women in the gym lifting way above the recommended guidelines, fun fact, some of these people are lifting up to 20,000 newtons of compressive force, which is in comparison to lifting a rhino. So there has got to be another factor at play here, especially since we see random people throwing their backs out because their muscles are too weak to even handle a bent over position. This has brought their attention to start looking into which spinal positions are the safest and the positions that can lead to the horrors of low back pain. Now let's focus our attention on a part that isn't talked about a lot. Lower back pain may seem like a strictly physical condition, but this ain't the case. We can undergo psychological distress when we have no choice but to limit physical movements, so which in turn can worsen the pain. People experiencing chronic low back pain tend to have a lower quality of life than those without this condition. One way we can measure quality of life is through the Health-Related Quality of Life, or HRQL, which studies things like physical and mental well-being, social relationships, and ability to function day to day. This can help survey how this condition affects people's lives and how they can manage it. Limitations of movement and interruption of daily activities due to lower back pain can result in psychological issues such as depression, anxiety, sleep disruptions, stress, or even a combination of these. And let's be honest, ain't nobody want none of that negativity in their life. So here are some interesting facts that I'm about to drop on you, girl. People with chronic lower back pain are most likely to experience depression and anxiety. All types of depression are associated with low back pain, and those with back injuries are 2 times more likely to suffer from anxiety. Patients experiencing depression and or anxiety often have greater perceptions of their pain and disability. They often experience a general fear of movement in hopes of avoiding agony or re-injury. Sometimes, though, the things we do influence how we feel. Smokers are often more vulnerable to chronic pain. A connection between 2 parts of your brain strengthens when you smoke, making you less resilient to pain. This could explain why smokers are 3 times more likely to develop chronic lower back pain than non-smokers. So both the direct pain and the indirect consequences of this pain vitally affects the quality of life for those suffering with chronic lower back injuries. Alright, Hillary, let me sum it all up for you. Lower back pain clearly affects many people around the world. The symptoms are often pushed aside, leaving the condition to worsen. It has plenty of detrimental side effects, not only harmful to our physical health, but also to our mental health. But at least the future is bright, because with more research being done, we'll have a clearer understanding of the symptoms, causes, and treatments of lower back pain. Luckily for now, there are many treatments options available, such as physiotherapy and yoga. But also, mindfulness is seen as the best course of action for lower back pain. So it is very important we take back pain seriously and take steps to try to reduce and prevent further pain so we can lead healthier and fuller lives.